mission for Migrant Clinicians Network has been really to be a kind of a support structure for clinicians dealing with patients that are migrants.
So we started Health Network because we were worried about migrant patients within the United States that needed to move because of work, and we were fearful that they wouldn't be able to stay in care. And over the intervening 20 years, from when we first had the idea to now, we've helped over 8,000 patients travel between the US and 111 other countries. And I think that that's really quite remarkable.
For Health Network, it has been to eliminate mobility as a disadvantage for patients that are on the move. Once the patient gets there, we want to make sure that there's continuity of care. So we will follow up with them to make sure that the patient remains under care. If they do finish treatment, we will get an outcome and report back to the enrolling clinic.
Part of what makes our work exceptional are the young people that comprise the Health Network team. They're committed to the patients that they're caring for. They really understand the importance of making sure no one is lost to care, and they feel this strong commitment to see the patient all the way through to the end so that they're able to say to them, if you need me, call me. Otherwise, I think we're in good shape.
A lot of our patients speak multiple languages, so what we do is we use an interpreter service to communicate with these patients. I guess what I tell my patients when they're going to the clinic is, you know, if you have any questions, if you feel like you're not getting your questions addressed, please give me a call. I'll get someone on the phone who can interpret for you to make sure that we get these questions addressed for you. Because it's important, and it's a basic right that everyone should have.
When we came here, we didn't know anyone. And I think for farm workers that, you know, coming from Mexico or coming from another country, when they get here, they don't know anyone as well. They may only have one friend, and that friend doesn't know anything as well. So it's good for them to know that there is assistance, there's something here that has their back.
All of us at the Health Network team have had someone that we know go through immigration or migrate to this country for one reason or another. And so it's very close to all of us to know that there's an agency and a mission that is taking care of people that usually don't get taken care of because of their migration. There's a lot of heart in what we do, and really that's what we are looking for in terms of a team. People that really do have a strong connection to the mission.
A lot of the health centers and clinics in other countries, or even in the US, there's not a whole lot of communication between them. You know, and so us serving as that kind of liaison and helping them get services, or even just transferring medical records, or finding some way to make that connection that makes their process of, you know, getting the treatment they need easier is a big part of that.
We had a case of a woman who'd come to us from Africa, and she was here to visit with family and then fell ill. And when she was worked up, they realized that not only did she have TB, but she also had HIV. And so the important work for us was to get her through the start of both treatments, and then see her through to the end of her TB treatment, and then make sure that she had a plan for a continuing care for her HIV. And over the 2 years that we've worked with her, what I think has been most important is the degree of communication and comfort between the patient and our healthcare team.
These patients are moving constantly, so it's really important that they stay under care, that there's good documentation, especially for TB. And without good documentation, it's really difficult to see if these patients are receiving treatment or not, or you know, if they've missed a dosage or a week of treatment. That's really important to know. So working at it as a team is really important, just to make sure those patients are able to complete the full course of treatment.
It's a small organization that does big things. You know, when I do talk to people from all over the world, they think that we're an organization that's maybe 4 or 5 times what we are because of our work. It's taken a lot of time for us to develop those relationships, but we do believe that we have a high standard in regards to the clinical coordination of care that we do here.
So all of the services from Health Network are free of charge to the patient and to the healthcare provider. And over the years, what we've been able to do is cobble together sources of funding in terms of grants and contracts, private gifts from foundations, from the federal government, from state organizations that are willing to support the kind of work we do because they want their patients to get through their treatment. It's been a variety of illnesses, some as severe as TB and HIV in combination, and some where it's just that the person needed continued care, and then once they finished their treatment, they were going to be in great health and could go on and not give us another thought. And it's that variety and those extremes that I think make our work so important.